There's no greater reward than when I see a patient that came into me paralyzed and then they're walking again independently. Just yesterday we had a patient and the owner was in tears yesterday saying, you gave me hope today. When people hear about veterinary rehabilitation, they think about two things. They think about the underwater treadmill. And they think about laser therapy. Like, that's rehab. You know, the reality is that a talented rehab practitioner does far more than underwater treadmill and laser therapy.
It'd be nice to get more elbow flexion.
Let's reset that to 500 again. What did you find on physical?
Yeah, I would do a measurement from the accessory carpal bone down to like the 5th metatarsal head.
There are two main focuses in rehabilitation. We're trying to improve pain, so make sure our patients are comfortable. Make you feel better. And the other is we're trying to improve function and what functional impairments they may have.
So we're going to help bring his ears up. It's just going to help to stimulate for him to hold up his ears on his own.
It could be a mobility impairment, but sometimes it could be a mental impairment. It might be that they have a respiratory impairment, they have a cardiac impairment, and all of that affects our body's mobility.
She's falling to the front, yeah, but she barely wants to stand on it. Do you see that? Mm-hmm. Ooh, she just wants to sit.
Rehabilitation really touches almost every other specialty in veterinary medicine, and why I love the term integrative medicine, because we really integrate all of those specialties.
So I have one finger on the acromion, and then my thumb is on the dorsal edge of the scapula.
So I am helping older patients a lot. We see a lot of senior dogs, for example. We also work with cats. We work with the exotics department. We work with birds, rabbits, bearded dragons.
Alice was accidentally stepped on, kind of contorted her spine, and it shifted her internal organs. They suggested she might benefit from acupuncture. She is able to use her back legs independently now, and she moves her tail.
We also see patients that have neurologic conditions. We also work with hospitalized patients. There is no limit to the patients we can help.
Seeing him walk and wag his tail and go chase a squirrel, he's just progressed so well and he's got such a quality of life. I'm so grateful.
She needs some support to stand. She can't do it on her own.
We are coming up with customized treatment plans specific to that patient. We use acupuncture, we use laser therapy, we use pulsed electromagnetic field therapy, TENS, which is transcutaneous electrical nerve stimulation. We use massage therapy, therapeutic ultrasound, customized exercise programs. We're going to do this shockwave therapy, which emits high velocity, high pressure, but low frequency sound waves. When those sound waves penetrate the tissue, it brings a massive amount of blood flow into the area and really helpful to restore healing capacity. So 5 degrees, that's good. Okay, so we did good improvement. All right, good. Dogs often need what I call a spa treatment. We're helping their bodies feel better because the muscles are sore or they've developed restrictions, often not at the area of injury, but in other places of the body where they have compensated. The underwater treadmill hydrotherapy is miraculous for dogs that are learning how to walk again. We see a lot of patients that are recovering from back surgery. So when we put them in the water actually helps keep you upright. It's fantastic for improving range of motion of the elbow. So if I have a patient that has elbow dysplasia, particularly if they have a lot of arthritis in those elbows, I love to swim them. They're moving against the resistance of the water, which is great for rebuilding muscle. If I have a paralyzed dog who is able to walk in the underwater treadmill, I know they will walk on land. We also do things like laser therapy, and laser can be really helpful for reducing inflammation. It can also be helpful to bring more blood flow to an area. Another therapy that we offer is acupuncture. Acupuncture can really help to energize a patient. It's particularly helpful for pain management. Most dogs tolerate acupuncture beautifully. Our patient Francesca here has an injury to the tendon that connects to the little toes. We do a lot of assistive devices. We have orthotics. We lowered the height of the wedge in here. That's what was pushing up her digits to straighten out. This is pretty typical of what we do with orthotics in that it's definitely time involved. It's always individual because different patients are at different stages of healing, and we always base the adjustment of the orthotic based on how the patient is doing. We also have prosthetics. Harry Litz is a really interesting case. He was rescued as a puppy with a limb deformity. In fact, at the time, they recommended to the owner to maybe amputate the leg. A really bright surgeon here at AMC said, you know what, why don't you try rehab and see if maybe we can do a prosthetic. It was really remarkable because we saw that Harry in the prosthetic achieves a normal posture.
The training that we're getting here is strengthening his leg. He uses it to play ball.
And another assistive device is the assistive carts. When we put our patients in an assistive cart, most of them are still using their legs. So it's really a support device. They can safely start to move and walk in the cart and get back to the activities they want to do. They can walk in the park again. Dogs can even play ball in their cart. I mean, it really restores their quality of life. The Schwartzman Animal Medical Center is the place I work because of the opportunities I have here that I wouldn't have anywhere else. The quality of care here is unparalleled. I did my internship here 20 years ago. It set up my entire career for practicing excellent quality of medicine. I have just a phenomenal team. They're my family, and we all have the same passion for helping our patients recover and bring them back the quality of life that they deserve.